Good evening. Myself, Dr. Yashwant, consultant gastroenterologist and part of Assured team. On this evening, I would like to congratulate Dr. Tapabrata Das, who has secured fourth rank in AIMS nephrology on behalf of Assured team. Congratulations, doctor.
Thank you. Thank you.
So, with this your success story, how are you feeling now?
I'm feeling fine now, sir. It hasn't synced in yet.
Okay. So, we want to know a little more that what brought your focus on nephrology, or what brought the interest in nephrology?
Mainly, sir, I wanted to do a specialty which had some good interventions in it. Like gastro is one and nephro is another, with very good interventions and with some kind of thing which could bring back patients from an end stage disease. And in kidney, it's always the end stage renal disease. We can give 10 to 15 years of very good life if we do a good dialysis, if we do a good transplant. And in my relatives, I also have seen quite a few patients who have led a very good life, because morbidity is the main important thing, not only the mortality. If we can give 10 to 12 years of good life, good quality of life to an end stage renal disease patient, then that's a big thing. And I've seen patients with very low GFR maintaining a very good lifestyle with good quality dialysis and good transplant.
I completely agree with you. Yeah. And even we feel nephrologists are more complete physician than any other super specialist. That's also is one part to add to it.
Yes, sir.
So, and can you brief your story? Like, since you decided that you want to take up nephrology, then how did you prepare all these days?
So I started a bit late. I could say that because when I finished my MD, I was a bit confused about what specialty I should take. I could not decide between nephro and endo. So then I decided that I should take a topic that each and every chapter that I like. In that topic, I should like each and every chapter. There shouldn't be a single chapter that I should open and I should think of what I'm reading. In nephro, I found that each and every chapter I love. Be it electrolytes, be it tubulopathy, be it glomerular disease, anything, any chapter I open, I like to read it. And any amount of big volume of books, it doesn't scare me. In nephro, it happened. In endo, it used to scare me a little bit. The reproductive endocrinology part. That's why I left it and just concentrated on nephro only. And I thought it would give me a better chance to do well in central institutes and also NEET SS.
Yeah, I'm sure you're going to love it in future also. But how was your preparation like?
Preparations are initially in my MD days. The Harrison part I read quite well. So the nephro part and the mainly initial few chapters, which is also the approach-based part in Harrison, which is also included in nephro, like the electrolytes and the uremia part. That I again read it thoroughly, because in MD times we try to read it in question-based pattern, how to answer a question from that. But in MCQ, you have to read each and every line, each and every tables. Any question can come from anywhere in that table. Harrison is very important. So Harrison is the base. So I tried to read Harrison at least twice, the nephro part at least twice. It helped me a lot to read the Fihali part then. Fihali, after reading Harrison, Fihali is easy. According to me, Fihali is quite easy. Harrison is the tougher part because it is condensed. Fihali is very lucidly written. Very good book. It's like a story book. You can read it in a relaxed way. You need revisions, but Fihali gives you the time also. It is not that condensed. So it's a very good book. And another cause I took nephro because Fihali is the only specialty book with one volume. It is very easy to finish it.
Okay, that's nice. Okay, so you could revise and appropriately even before exams, CMS exams.
Not too much. I just tried to sort out few things which I forgot a lot. Few pockets in nephrology in which once you form a very good understanding of it, you don't forget. Like few glomerular diseases, tubulopathies, but few areas like the anatomy part of it, the development of part of it, a few tubulopathies in which the genes and things that we have to remember, a few studies in nephrology which we have to read 2 or 3 times to remember the names and the studies which central institutes do give. This time
Yes,
also
yes.
2 or 3 questions came from studies. So in
Okay.
NEET it is not that important, but in central institutes we have to read. Like in AIMS, we have to read. So
Okay.
that's the few things I decided before the exam, that I had limited time because I was doing COVID duties, it's a very tiresome duty, and after also the duty and the tiredness lasts for 2 3 days because it is so tiresome. So I had to plan it in a very methodical pattern according to uh, how I remember things, because it changes according to students. Few students find tubular diseases in nephrology very, very tough, but I find it very easy. Uh,
Okay.
but I find the developmental part and the anatomy part a bit tough. So I revise those parts. And the electrolyte part is always tough. We have to revise a number of times. Still, I have few caveats which is
No,
still I don't understand. I'll try to understand in the next 3 years.
no, I'm sure you will enjoy the subject. Then, where did the Ashur came in your preparation?
Assure I also took very late, about late January or February 1st, because I gave an exam which was free for all, uh, an
Okay.
Assure specialty exam. Not the specialty, but the Harrison based exam. That was a Harrison based exam. Nephro was a part of it. So after giving the exams, saw that the pattern of exam was very good. The questions were very good. The explanations were excellent. I scored a rank of about 30 31 in that exam. They also mailed me the rank also individually. So I was quite pleased after giving that exam. So I searched in the net about if they have any subscription. So I took the subscription. I took Nephro first. I loved
Yeah.
the way Renju sir and Avinath sir taught in so detailed, and the classes they in classes what they taught us, it is not only helpful in the entrance examination, but it will also help me in these 3 years also. uh, all the PPTs that they have given, those are they have included all the important things that an Nephro resident needs during the
Yes.
3 year course. That Navinath sir also told us while he taught us that not only he is teaching us for the future exams, but also the 3 years of residency, when very few people will teach us taking time from their busy schedule. So he told us to keep these notes and these PPTs with us. It will help us in the future. And I have kept those. I kept everything.
Yeah. Yeah. Sure. I'll convey your regards to both of them. Then, I suppose you had tough time with the COVID pandemic on. You would have been simultaneously working and
Yes, sir.
studying. How could you manage both the things?
So mainly what I did, as I had very limited time and I knew I could not revise fairly fully. So I had to make something that I could revise before the exams. So what I did after doing the classes, which is about average 2 hours per class. So I did the class, mostly I did the class afterwards, the recorded version I did, because with our duty times, we could not attend the live class always. I did it afterwards and made notes according to it. Uh, Everything that I thought which was very new to me in the class, few things were known, few things were very new, and few things I knew but I forgot. So
Okay.
that I used to make priorities, that in these notes, this part I have to revise, this part I will remember, this part I will not see before exam because it is too easy.
Hmm.
That's why I made the compartmentalized each and every chapter. And some chapters to me were so easy that I didn't touch 15 days before exam, because those were
Okay.
too easy parts. And there were few very tough parts which I had to see 3 or 4 times.
Yeah.
That's why each and every transplant and dialysis part is very new for us, because we are not exposed in our MD days.
Yes.
So
Exactly.
I didn't take both of them lightly, because everything was new. However easy the concepts were or difficult the concepts were, we need revision in transplant and dialysis. So transplant and dialysis, I revised at least thrice. The notes part and the classes, I saw the classes twice, because finally it is not possible to revise 2 or 3 times before exams with these duties. So
Yes.
I had to prioritize something, and
Yeah.
I did that part. The glomerular and the tubular parts were quite easy for me. The few important new things we have to revise, but once you get the concepts, it usually stays with you. If you do it, read it very well for the first time. So
That's great.
it was not easy, but
Okay.
the classes made it easy. The classes made it easy. The classes made a big difference. From February, I made a very a big change. I could feel my knowledge was increasing. The tests were going very well. I was scoring consistently well. So that's why in also the final exams, I didn't take any pressure. I didn't take any pressure, because if I take pressure that I have to score within rank 5 or I'll not get in a seat means, I'll never do it. I'll never do it, because the competition is very tough. It's all about decimals of scores separate us. So luck factor is also there. So the boy who has scored 10th rank, he is as good as me or better than me.
Yes.
On that day, I was a bit better.
I completely agree with you. There might be only slightest difference, and what you think in the exam hall, that also mattered to an extent. And as you said, a bit of luck, that also matters.
A bit of luck is always needed. The syllabus is so vast. A bit of luck is needed. Some educated guesses should come right.
Yes. But what I feel is, to make this educated guesses, your background thinking, background basis of the and the knowledge always helps. So even to make those guesses. Yeah.
Yes.
And anything? Any tips for those who are aspiring to get a DM seat, or who want to follow your footsteps?
Mainly, first thing I would like to say that many aspirants, I have talked to many in these 6 months. Many of them they don't even try for the central institutes, because the seats are very less. That thing should be, they should not even think about it. It is very gettable. It is very gettable. People just don't try. The whole DM thing is like that. People think that DM is a very unreachable thing. Central Institute is even more unreachable thing. I am a very average student and nothing special. I haven't scored a rank 1 in my college days. No gold medals, just a single honors. Nothing special. But what I did in my MBBS days or MD days, that I tried to be a little sincere. Read Harrison. I didn't read the whole Harrison, 60 to 70% of Harrison, because the infectious part is not so much important for us. But I tried to read the Harrison, and in this part, in the nephro DM part, which is the main concern here, NEET SS is quite doable, because the seats are increasing, and the competition is less rather than the Central Institute. But still, the medicine part is the tricky part in NEET SS and PGI also. You have to read medicine thoroughly, especially in PGI. The pattern of question in NEET is still easier than PGI. So, and in the nephro part, you have to read Harrison twice or thrice, because every line in Harrison is an MCQ, because it is so condensed. It is taken from Fihali, taken from Brenner, taken from Oxford. After reading those textbooks, when I returned to Harrison, I appreciated how good a book it is. In the MD days, I couldn't understand Harrison so much. I thought that he has packed everything. It is not at all a good book. Too much information. He has not understood what he is writing. But now I understand that I didn't understand what he wrote. Now I'm slowly understanding, and I'm again reading Harrison, because it unfolds every time I read it. Unfolds something new. The tables, the chapters. It's so
I really like your humbleness, that you accept that what you know, what you don't know. That's important, because when we accept that what we don't know, then only we learn
That's
ahead.
the preparation starts from there. In
Yes,
September,
yes.
I saw that what I knew and what I don't know. I saw that the don't know part is too much. So I tried in the first 4 months. I didn't compare myself to anyone else. I just tried to make myself better. I knew that I was not good enough 6 months back.
Yeah.
I just tried and I just read and read and read. Uh, and every day, consistent reading 4 to 5 hours is more than enough. It's not that you have to read 10, 12 hours. 4 to 5 hours of very good reading is just good enough, more than enough. Nobody reads. I read every day, every day. When I also came back from COVID duties, I used to read for 1 to 1.5 hours. That's the practice. That might have not been very high yielding, those readings, but just the practice to sit every day in front of the book and read those books, just to see a lecture or revise a lecture. Here, where the videos are very useful, sometimes I felt I could not read, and the energy was so low, but we can always see a video. Instead of seeing a YouTube video, I saw Navinath sir's video. That was the difference. In last 3 months, I just did that only.
Yeah,
I
your
tried to keep it
consistency
simple
is,
because that's the main thing. The tenacity and consistency is the only thing that
yes, yes,
makes the
yes.
difference. More or less, every student is same only. 2, 3 very high level people are there. I'm not like that, but they are blessed. But we are not blessed. We have to work very hard, and
Yeah, I
that
think a
is
lot
the.
of us have to work really hard. Very few will be blessed. I think the hard
Yeah,
work will definitely pay off. So,
yes.
through this media, anything you would like to convey, Dr. Tapabrata Das?
I
Anyone you
would
want
like
to
to.
acknowledge?
So I want to acknowledge 3 people from Assure only. One is Muthu sir, one is Navinath sir, and one is Renju Vinay sir. Renju Vinay sir, in last 2, 3 months, I usually WhatsApp him, not even just exam-related cases. I used to discuss my hospital cases with him, the
Oh,
nephro
that's
cases.
great.
Recently, I diagnosed distal atria in my hospital after
Oh, that's
consulting
great.
with him. Uh,
Okay,
so
okay.
so so it was not just about the exams. It was about the process was about learning.
Yeah,
That's why even after the results came, I'm still watching the Assure videos
yeah, yeah. That's
because
great. That's
it, it, it,
very nice to hear.
it has just begun now. And if I stop watching those, I'll again forget everything because my memory is not that good. Uh,
Yeah. So, we'll wind up our interview.
okay,
Thank
sir.
you, Dr.
Okay, sir.
Tapabrata Das. We are very happy to be part of your success. We wishing
Thank you,
you
sir.
all the best to start your career as a nephrologist. We'll be always there with you. All the very best. Thank you.
Thanks again. Thanks again.
Yeah. Thank you.